Hello, everybody. Thank you so much for joining us today. My name is Dr. Janvi Pinyarthi. I am a pharmacist with InpharmD, and our goal at InpharmD is to drive evidence-based care with the help of AI. And we know AI has been the latest buzz in the medical community, and we thought it would be great to learn some insight from pharmacy leaders about how AI solutions and AI in general can be implemented in the healthcare space, specifically health system pharmacies, clinical pharmacy in general. So I am so delighted to be joined by Dr. Anthony Scott. He is the Director of Pharmacy Services at Emory. I will hand it over to Dr. Scott. Would you like to introduce yourself?
Yes, thanks again for having me, and looking forward to working with you on this program and the topic, and talking a little bit more about AI. Pharmacist by trade. I've been in leadership now for a little over 13 years in various capacities. I've been an operations manager, been an assistant director, currently serving as the director of pharmacy services, like you mentioned, here at Emory University Hospital. I've been here for a little over 3.5 years now, so I oversee all of our acute care spaces and work with a great leadership team here to take care of our patients and take care of our people. And this topic has been a passion of mine for quite some time now, in terms of not only on the learning end as a practitioner and understanding the impact of AI in pharmacy and all those good things, but also trying to kind of be more of a thought leader and engage in some discussions and more content around applications, questions, risks, and just thinking about future state when it comes to healthcare and pharmacy, specifically for AI, automation, intelligence, all the above. So happy to have selected for this, and looking forward to talking with you more. And hopefully the people checking in will take home some good deliverables that they can use in real time to impact their practices and impact their team members directly.
That's awesome. Thank you so much, Dr. Scott. So before we get started, kind of tell me a little bit, what was your first introduction to AI? What really sparked the interest? Kind of what sparked the passion?
Yeah, I'm always more of a hands-on leader in terms of engaging with software and hardware, and thinking about not just how to get more efficient, but have better deliverables, better outcomes, making data-driven decisions, and kind of getting a good understanding of kind of what the landscape of healthcare looks like currently and is moving to. Companies like InPharm and a few other vendors who are kind of specializing in this space have really kind of focused on the specific impacts of opportunities with AI when it comes to drug information or clinical decision support or other tools that may impact our day-to-day. And so from a director perspective and an administrator's perspective, I know that it's only a matter of time before these tools and agents start to impact our decisions and how we practice and where we practice and all the above. So my initial interest kind of gained there, just learning about current vendors and hearing about discussions. I love podcasts. I love to look at stories and watch YouTube videos and TED Talks, and you can probably do a content dive and a deeper dive there and find hours and hours of content on AI related to healthcare in those spaces. So just doing a little bit of self-learning and reflection kind of got me interested, and partnering with organizations like yours and reading about what's coming, what's out there, understanding how the applications are outside of healthcare has been a lot for me in terms of setting that foundation, and also just thinking about what kind of future are we going to be impacting as practitioners as we learn to adopt these tools and use them safely and effectively, and hopefully lead to better outcomes for our patients and our people.
That's awesome. I love that. And I'm so thrilled that you're an InpharmD partner, and we're so thrilled to be partnered with Emory. I think it's great. You talked about the AI space, and I know that in this space there can be a little bit of confusion with some of the terminology. So what would be your insight into some of that base level terminology? How can we differentiate some of the common concepts or words that we hear when we talk about AI?
Yeah, that's a great question. I think trying to wrap your head around everything and understanding not just current state, but the rate of change in this field can be very intimidating. So I think just from a definition and from a high level oversight perspective, my focuses that I would encourage the audience to think about as well too, is just understanding, okay, what is AI? The science of making machines and automation think and act like humans. Artificial intelligence, humans have inherent intelligence through our neural networks. The goal is to try to replicate that through artificial means. And so thinking about artificial intelligence and thinking about what does that mean from a baseline. So Once you kind of get that foundational understanding of just listening to the term and trying to create that high level definition, then it's important to kind of understand the different modes and mechanisms and processes that can build or enhance or distinguish between AI platforms and tools. So, narrow versus general versus generative AI in terms of what is artificial intelligence intended to perform or to produce as a result of any input from a human or from an automated resource. Understanding the differences between machine learning and deep learning in terms of how do algorithms and computer-based data sets and artificial neural networks help to increase the data functionality and the features and the instructions that come from AI and some of the models that you're used to using, whether that be a Google platform or ChatGPT or a chatbot or anything that you kind of interface with on a regular basis that you may not recognize as either built on or based off of foundations and principles for artificial intelligence. And then really understanding kind of the different types and just without going into specific details, specific low types, very reactive. You put in a process or an input, you get a result. Those are kind of low level baseline models and mechanisms for artificial intelligence. And then you've got all the way up to the highest type, which is self-awareness and computers that can think and make decisions and generate some type of quote unquote feeling that distinguish it. Is it from a process that is from the lower level types? And so understanding those algorithms, those natural processes, how the input and data comes in together to kind of support some of those artificial AI foundations, and then thinking about how that continually exponentially grows and gets better is really a good way to not just do some personal research, but also establish some of those baseline foundations from a definition perspective to understand that and use that knowledge to kind of build on that foundation for more expansive concepts when you start going into the weeds a little bit more when it comes to specifics around AI.
And how would you differentiate automation from artificial intelligence?
That's a great question. So I think on my end, from a pharmacy perspective, automation is kind of the hardware in terms of what we do to become a little bit more efficient or safe or provide more high quality outcomes from an efficiency perspective when it comes to either medication distribution or people management or any other thing that we can use from a technology perspective. And so I think automation is kind of that baseline foundation that can be supplemented with artificial intelligence, whether that's decision making or data analytics or dashboards or visuals or whatever it may be. Automation is kind of the hardware, the physical tools that get the job done, and artificial intelligence is kind of the brains or the computer processing that happens behind the scenes to enhance what the either automation is capable of or what capacity it can have or what it can do. So that's how I try to keep those two things separate and distinct in terms of those definitions and understanding that there's a lot of impacts for AI within automation. And that also kind of builds on that foundation of kind of what we see some of the earlier impacts in this space are for healthcare in general.
Excellent. Awesome. And so we talked a little bit about the impact with AI in healthcare, but kind of drilling down into clinical or health system pharmacy specifically, how do you think AI can change the field for health system pharmacists?
I think with great power comes great responsibility. And so with that, I think there's a lot of opportunities for us to think about how to implement AI tools and software and other kind of hands-on deliverables that may enhance our patient care processes or people processes, but we have to do that strategically and kind of take a risk stratification approach to understand what these changes are, what are the benefit profiles, what are the risk profiles, and how is that managed comprehensively to ensure quality outcomes, safe outcomes, improved experiences, or even improvements around efficiency or reduction of waste, reduction of errors, doing it ethically, make sure that data is validated, and make sure that the things that we're trying to use and change are going to be something that we can regulate and oversee from a healthcare perspective. So, we're a practice that has a lot of requirements from a regulatory and compliance perspective. And so as we think about these tools and potential utilizations, what are the case studies or what are the published reports in terms of use cases now? How do we ensure things are done safely? How do we make operational considerations and financial considerations and clinical considerations for things that are having applications, not just in pharmacy, but in healthcare in general? And starting with those multidisciplinary type of foundational discussions to kind of build on that growth, I think is a really good starting point there, and something that we all should be thinking about, whether you're an administrative role or a frontline practitioner, or even outside of pharmacy.
And um, so what specific, I know we talked about efficiency a little bit, and kind of you mentioned use cases where it would be successful. Is there a specific efficiency user case that you think would be most successful, where AI could like really benefit? What type of efficiency are we looking at? I know you mentioned both administrative and frontline, but is there a specific type of project or like within efficiency a space that comes to mind?
Yeah, I mean, I think what we've seen initially and kind of what we're looking forward to see is, probably the biggest one for me is just clinical decision support and the use of AI in terms of predictive analytics, task prioritization, maybe personalizing treatment decisions or understanding patient profiles or impacts from a healthcare perspective to support more efficient, faster, timely, and higher quality outcomes for our patients. So I think that's kind of a low-hanging fruit that we can think about, all right, in terms of our EHRs or other additional add-ons or vendors that are currently working within this space. How are we using AI to support clinical decision support, reducing the need for repetitive tasks, supplementing what we bring from our human knowledge as providers and practitioners to add on to that so that we are ensuring the best outcomes for our patients, and kind of leveraging that with additional safety tools to make sure that that's being done safely. So I think that has the biggest impact right now. I think also a lot of data analytics and review of probably optimal outcomes also is a big piece of that pie, and something that we should be looking forward to pretty specifically when it comes to AI tools that can help just with visualization, efficiency, helping eliminate redundancies, and also outline things like quality markers, treatment recommendations, patient education, distinguishing medications from a research perspective. I think a lot of those specific tools in AI are really applicable right now, and things that we can, have hands-on impacts on and help develop best use cases and case practice scenarios for in real time.
So one thing that I've heard from pharmacists in this space, they're like, I would rather a pharmacist make like a human make a mistake instead of an AI get it right. So I know there's a little bit of distrust, right? Still, we I know like part of pharmacy tends to be very traditional. So what would you say to those pharmacists who are maybe a little bit hesitant about implementing AI in their space?
Yeah, I mean, the risk for error or the risk for ethical challenges is very high within this space, right? So I get a lot of press releases and articles that I read through pharmacy organizations and Beckers and other platforms where talk about errors, or they talk about workflow challenges or issues with data validation, or potential biases in some of these programs and algorithms that may be patient facing or patient focused from a healthcare perspective. So I think there's a lot of, it's easy to be hesitant, and as practitioners and as people who've kind of driven human-driven outcomes for so long, I think we have a natural bias toward trusting ourselves and trusting our inherent abilities before we would fully automate that or fully outsource that to a computer program or to an AI-based software tool. So I think there's going to be requiring a lot of balance there. I think starting with making sure that our human foundational input and oversight, if we're even thinking about integrating these tools, is the core of the foundation in terms of ensuring that we keep our risk profiles as low as possible, is a really good start. I think we should always be inherent to minimize, if not being able to eliminate, the risk of error or variance. And so how do we do that safely with these tools to say that, hey, maybe if there is risk for human error, what can we do from an AI integration perspective or support tool to either minimize that or reduce that likelihood, because we want to take care of our people and our patients. And so, people who have those points of views or understandings or thoughts that are very either risk averse or change averse, it's going to take some time to create stability and faith that those tools and understanding how that may interact with AI and automation to support those outcomes are going to be realized. And there's always discussions about what does it do to jobs, and what does it do to security, and what does it do to the things that we have normally been used to doing, specifically in healthcare. And so if you have that perspective or thought, I challenge you to think about how you can be a little bit more open-minded to understanding how these tools may support that, and also thinking about what our long-term outcome is to reduce risk and uh, provide safe and quality outcomes and lowest error rate as possible, or providing the highest value as possible. And so if these tools can help us do that, then I think it's worth all of our input and effort to figure out how do we do that safely and effectively, and not just only say, well, I'd rather, again, a human make an error before I let AI do something correctly, because I think if we don't proactively lead to some of those changes, that may be forced upon us future state.
Yeah. No, I completely agree. And I feel like looking at kind of the new AI solutions that are coming out are just so interesting. And just the way that technology has progressed has just been so incredible. You mentioned integration. So what do you foresee, like, what challenges do you foresee in terms of integrating AI solutions into pharmacy practice? Are there any like operational challenges, or kind of what are the biggest challenges to integration here?
Yeah, I mean, when I think about integration and growth and change, I always think about, pros, con, risk benefit profile. So I think some of the biggest challenges are just how do we establish what those pro and con lists are, or risk benefit profiles are. If we're looking at benefits, how do we quantify those, and how do we ensure that those will be reliable benefits that can be repeatable and can come from some changes in terms of the use of technology or AI within the space of automation or any other applications within the space. I look at what are the clinical benefits in terms of, your company when it looks at drug information or clinical documentation. How do we automate some processes around the use and evaluation of medications or treatment algorithms, order sets, clinical decision support, as we talked about earlier, and trying to find that balance there. Risk benefit profiles, looking at operational needs, inventory management, contract reviews, product verification, order verification. How do we understand the risk benefit profiles there to increase safety, but also ensure that there's good outcomes on both sides of the fence there when you're looking at potential integration of AI. Financial benefits and risks, is it impacts on revenue cycle, return on investment, how will that manage claims or revenue cycle implications, whether you're a hospital or ambulatory or retail or whatever practice setting you may be in. And what are the pros and cons there? Because when it's not about money, it's about money. So understanding those dynamics and being able to look at that at a high level when it comes to risk benefit, I think is very important as well. So I think those are really three buckets that really can kind of emphasize some of those questions and give us really good starting points to think about from a leadership perspective, and from a even from an informaticist perspective on how do we move forward with some of these platforms.
Amazing. I completely agree. Um, so a couple of maybe some of the younger audience members, some of the students, I think they worry like, will AI replace my job? And I know like back in the day, like some people would worry like, oh, would robots replace pharmacists? And I've heard both sides of the argument. What are your thoughts on, will AI replace any pharmacy jobs? What are kind of your thoughts? I know that this is more probably like a little bit of a personal question, but kind of I'm curious to know what you think.
Uh, I have a pretty optimistic viewpoint on that. I think, the use of AI and these types of tools will help us become more efficient with our labor. So I don't think we'll ever get to a point where there's going to be no labor involved in decision making or delivering of oversight of treatment, in terms of just, when we talk about healthcare, part of caring is having that human intuition to provide care and be caring. So I think, future state, these tools and these platforms will allow us to be more efficient with our labor. We talk a lot about working at the highest level of your license, or practicing at a high level, getting out of the weeds, eliminating redundant or non-value added work, things like that. So I am optimistic that if these tools are reviewed and implemented correctly, it will help us to achieve some of those goals. But I think we're always going to need people. I think part of delivering care is that there's a people-oriented aspect to care, and the potential applications of these tools are going to need some human oversight in terms of implementation, review, setting quality standards, quality analysis, shared governance, having transparency and disclosures about what's happening and what's not happening, policy and procedure development around this. All these things are going to take human input and human oversight and management. So I'm less pessimistic that that's going to be something that's going to come in and get rid of all the jobs. There was a discussion I was listening to on a podcast a few days ago about the Industrial Revolution, and how, we moved away from manual farming and manual labor to more machine oriented productivity around efficiencies, and it not only expanded the economy, but created our modern system for capitalism and created a lot of growth and dynamic opportunities that people could not foresee before some of those tools were implemented. So I think some of that is we just can't really see what the future looks like specifically. There's no crystal ball. So some of those kind of inherent worries are there. But again, I think if done right and done correctly, it's going to enhance what we do and create more value added work for us versus eliminate the need for us to be around. So maybe we can revisit this conversation in 20 years, but hopefully I'm right about that.
Yes, it sounds like, or I think AI has the ability to maybe optimize the pharmacist role. I agree with you. I don't foresee the human factor going anywhere, but it's definitely interesting to like hear both sides of the argument. And I completely agree with you. I also take that more optimistic viewpoint. Um, I know we're nearing kind of the end of our talk here. I wanted to ask you one last question. So right now there are so many directors similar to your position who are evaluating these different AI solutions, thinking, how can I implement AI solutions in my practice to optimize my practice? So what would you recommend to health system pharmacists, especially in this director level, who are looking to adopt AI solutions? Kind of what would be your like biggest piece of advice, biggest recommendation as someone who has extensive experience in the space?
Yeah, I mean, for me, I think personally, what I've learned a lot in terms of exploring some of the vendors in current state is really get a great understanding of your processes and kind of what the value equation is coming from the vendors who are, being perceived as experts within the AI space. So whether it's on process implementation, hardware, software, thinking about testing, oversight of maintenance and changes within the workflows or standard work or whatever you're looking to improve or sustain or get better. Really make sure that you've got those core foundational understandings of those processes and understanding the value equation that the vendors will bring to the table in terms of how those considerations will impact whether that's a tool or a software or a program you want to either move forward with or not think about moving forward with. Understanding that there's a big learning curve, I think is a big piece of the pie there in terms of just thinking about future considerations and, things are not going to just automatically come to you. You have to be proactive in seeking out information, learning what's out there, thinking about what are the applications that have been outside of healthcare and maybe how some of those applications can impact healthcare and really using that to kind of create some of those risk benefit profiles that we talked about a little bit earlier as well. I think we all have bias and kind of inherent implicit biases around things that we like or don't like. So think about what can you do to tangibly assess and make those decisions as objective as possible when it comes to considerations in the space here and trying to eliminate the impact of bias. Verifying and trusting information and sources is a big one too. So if you're doing exploration and research or getting presentations or hearing content, figure out what are the right questions to ask, understanding what kind of information you're getting and figuring out how to validate and verify what you're hearing is definitely important. And asking those tough questions, especially if it's a direct engagement with a vendor or you're doing your own personal research. For me, that's always been a really good way to understand not just potential applications, but trying to figure out how do I bring as much transparency and disclosure to any kind of process or review as possible. And then really it's about, again, risk management and thinking about what are some of the long-term implications of what's coming and how can you get ahead of that. So, from a leadership perspective, I like to be more proactive than reactive. So I like to get ahead of changes before they get to me. And so this is a great opportunity for us to be proactive and not just how we think about those things, but product selection, implementation, interdisciplinary reviews and engagement, and just thinking outside the box a little bit in terms of what kind of things can we check off on our boxes to be prepared for this from just a regulatory, clinical compliance and operational perspective as well. So I think those tools have worked well for me and my team. I think those are great tips and things to consider for those out there who are in those initial journeys of thinking about performance metrics and benchmarks and use case scenarios and implementation and other opportunities with integration or interoperability with some of these tools. And those will really kind of give you that good foundational platform to move forward with, ask the right questions and figure out how things can work on those specific timelines that you have targeted, but also just give you a better sense of comfortability with this topic and kind of what those next steps may look like across different organizations and different platforms and different practice settings.
I know I said last question, but I had another question based on what you said. You mentioned verification and validation, which I think is so important. What would you recommend to pharmacists on how to verify information correctly? How do they validate if an AI solution is actually helpful or accurate? Are there tools out there that help them validate, or is it more like you mentioned, just personal research, trying to get as much information as you can? Kind of what are your recommendations on that validation and verification piece specifically?
Yeah, that's a great question. I think we have seen comparisons to analogizing that to the pipeline of drug development, right? When a company brings a new drug to the market, how do they know it works? How do they know it's effective? How do they know that it's going to have the intended consequences? So, really focusing on data and discovery, testing and piloting, and training the people who are going to be the experts and subject matter stakeholders inside of using some of those platforms are really important there to help with validity and testing. Engaging in partnerships and multidisciplinary engagements. At our facility, I rely a lot on input from my peers and partners at other facilities who may have tried things or who may have had exposures to certain technologies or different tools and kits to just say, hey, what's worked, what hasn't worked, what are you using for validation, what kind of additional checkpoints have you put in place to maintain safety, efficacy, et cetera. And so you really can get some really great ideas in terms of not having to reinvent the wheel and leveraging what your peers have done. Getting recommendations from the vendor. What are your use cases here? What kind of accuracy or reductions in errors can you show? And how do you manage that long term? A lot of these platforms and tools are based on algorithms. And so there was a term that was shared by one of my colleagues that was coined algorithmovigilance. And so how do you remain with your due process and oversight of these algorithms to make sure that they're having the post-marketing impacts or the post-implementation impacts that you're expecting them to have? And how can you partner with the vendor to ensure that that's happening consistently so there's no variance? So a lot of that is very hands-on. A lot of that is having the right stakeholders at the table in terms of engagements and asking questions and doing a lot of surveillance, especially post-implementation if you're moving forward some of these tools. And a lot of that has to be done routinely. And again, that's kind of that ongoing safety and quality assessment that we can do as leaders and practitioners who are supporting some of these use cases to ensure that those questions are answered and that we're doing this as safely as possible.
I love that word, algorithmovigilance. I'm going to use that. I love that. That's great. Thank you so much, Dr. Scott. Just this entire talk has been so insightful. I've learned so much. I know our audience has learned so much, and I think this is going to be really helpful for a lot of pharmacy leaders out there who are looking to implement these AI solutions. We are so grateful to have you as an InpharmD partner and to be able to learn from you. Just thank you so much for being an InpharmD partner and for doing this talk with us. We really appreciate it.
My pleasure. I appreciate the invite, and this is going to be a space that I think is going to continue to grow very quickly, and there's going to be a lot of changes and a lot of things to try to keep up with at a very fast pace of time. So I encourage everyone to, again, try to be as optimistic and proactive as you can within this area. Do your research, ask the right questions, and let's partner together to make sure that we're having the best outcomes for all of our patients and our people. And I look forward to continuing to see more developments here and continue to see your company kind of lead the way in some of those initiatives and engagements. So thank you again, and I hope you guys found that value added and very helpful for your individual practices.
Thank you so much, Dr. Scott. For our viewers, you can learn more about AI and pharmacy at InpharmD.com. And please be sure to follow both InpharmD and Dr. Scott on our LinkedIn channels. I'm linking them below. See you next time. Thank you.